AP septum anomalies. But before you discuss the AP septum anomalies, you have to understand the normal AP septum. Then you can discuss abnormal AP septum. In fact, you will be talking about three things here. What are the three things? There will be AP septum anomalies, number 1 to 3. Number 1 is the persisting truncus arteriosus. Persisting truncus arteriosus. And number 2 will be transposition great vessel. Transposition great vessel. And number 3, tetralogy of Fallot. They are all cyanotic heart disease. Congenital cyanotic heart disease. Why they are congenital cyanotic heart diseases? Because they are present since birth. Yeah, but why they are cyanotic? Because there is right to left shunt. And what is right to left shunt? Right to left shunt means the pulmonary blood which was supposed to be oxygenated is directly going into systemic blood. Oh, you mean to say there is some shunt which is called right to left shunt, because right to left shunt means the blood which is on the right side, which is supposed to go to lung for oxygenation, is not going for oxygenation, directly going to pulmonary to systemic circulation. Yes, this is called right to left shunt. Obviously, if the blood on the right side of the heart go to the left side of the heart without oxygenation, there will be cyanosis. And that's why they are cyanotic heart disease. So, can we discuss them one after the other? Yes, we have to, but first you have to understand how the AP septum is formed. How the AP septum is formed. I think it was using some neural crest cells. Yes, the neural crest cells are now supposed to come to truncus arteriosus region. And as the neural crest cells are coming towards the truncus arteriosus region, it will develop some ridges. There is a truncal and bulbar ridges in the truncus arteriosus wall. So this is the truncal bulbar ridges. I thought it is called conotruncal ridges. Yeah, some books will say conotruncal ridges, and some books are telling truncal bulbar ridges. No problem. So conotruncal or truncal bulbar ridges, what are they doing? They are growing and fusing with each other, and when they fuse with each other, then there will be a septum in the vessel. You're telling that these ridges will grow and fuse with each other to form a septum and separating vessel into two parts. Yes, which vessel? It is a truncus arteriosus, and the truncus arteriosus is divided into two vessels by this AP septum, which is spiral septum. Yes, you know it is a spiral septum. It will divide the truncus arteriosus into two vessels, and the two vessels are also spiraling each other. Which are the two vessels spiraling each other? You remember there was an anterior pulmonary trunk and posterior ascending aorta in an anatomical position you are seeing. Okay, so this is the way. Yes, actually anterior is pulmonary trunk and posterior is the ascending aorta, crossing each other. All right, this is the pulmonary trunk anteriorly. Yes, and then ascending aorta posteriorly. Yes, and both of them came from the same vessel, which is truncus arteriosus. Right. See, this is the AP septum, which is dividing the truncus arteriosus into two parts. What if the AP septum is missing? If the AP septum is missing, then it could be absence of neural crest cell. So when there is an absence of neural crest cell migration to this region, you may not have AP septum. And when there is no AP septum, then the old vessel will persist. Who is that? Persisting truncus arteriosus. So in that case, you will not have any pulmonary trunk or aorta. So if I don't have any ascending aorta or pulmonary trunk, then what do I have? What you have is the old vessel. It is called as the persisting truncus arteriosus. So persisting truncus arteriosus means truncus arteriosus is persisting and it has not divided into two vessels? No, because you don't have AP septum there. Persisting truncus arteriosus now, because I don't have the AP septum, because I don't have the neural crest cell in the region. Yes, that is anomaly number 1. If you say that is the anomaly number 1, then what is the anomaly number 2? Sometimes AP septum is not spiral. Tell me what will happen. Normally AP septum is spiral. If it is not spiral, I remember. What do you remember? These vessels, they are normally spiral to each other. They will not be spiral. They become straight. Because AP septum is straight. And they open into opposite chambers. You mean to say transposition great vessel? Yes. If AP septum is not spiral, it is straight. Then the vessels are not spiral, they are straight. And if the vessels are straight, then what will happen? They open into opposite chambers, opposite ventricles. This is called transposition of great vessels. Can you see a diagram for TGB now? Yeah, wait for some time. But this AP septum can migrate anteriorly sometime. Now what will happen if the AP septum is migrating anteriorly sometime? Then this vessel, which is anterior, will become narrow. It is called pulmonic stenosis. Third anomaly? Yes, third anomaly. Sometime AP septum is migrating anterior and narrowing the anterior pulmonary trunk, leading to pulmonic stenosis. And what will happen to the posterior aorta? Posterior aorta obviously will become large. If anterior vessel becomes small, posterior vessel becomes large. It is called overriding aorta. Overriding aorta with pulmonic stenosis. Are you trying to talk about the tetralogy fallet here? Yes, remember, tetralogy fallet occurs due to anterior migration of the AP septum, resulting in anterior vessel narrowing pulmonic stenosis, and posterior vessel become very large, which is overriding aorta. Now we have to see some diagrams for that. AP septum anomalies. Yes, 3 of them. What are the 3 anomalies you want to discuss? See, this is normal heart. First you have to understand. So first you have to see and understand normal heart. What is normal heart doing? See, there was an AP septum which is spiral septum. That's why these vessels are spiraling each other. And is the right ventricle which will send the blood into pulmonary trunk and towards the lung for oxygenation. Yeah, that I can understand. So it is the right ventricle sending deoxygenated blood into the pulmonary trunk, into the pulmonary arteries, towards the lung for oxygenation. Yes, it is understood. Then lungs will send it back to the left atrium, left ventricle, and that left ventricle will send the blood into the aorta. So you're telling that lungs would have oxygenated the blood and sending into the left atrium and left ventricle, and then blood is going to pass into the ascending aorta there. Yes, ascending aorta there. This is normal. Can we draw something normal here? Yeah, you can draw the normal thing. 4 chambers of the heart. Normal heart, 4 chambers. And what are the 4 chambers of the normal heart? There is this right atrium and left atrium, and then there is this right ventricle and the left ventricle. Okay, then what is happening? Normally you'll find that blood will enter the right atrium. How? By superior vena cava and the inferior vena cava. So where this blood will go? This blood will be passing through this valve. What is that valve? Right AV valve. What is right AV valve? The right AV valve, you know, tricuspid valve. So that is tricuspid valve, and blood will come to the right ventricle now. Yes, and leave the right ventricle by this vessel, which is called as pulmonary trunk, dividing into pulmonary artery towards the lungs. So you are telling right ventricle, which is having some deoxygenated blood, will enter the pulmonary trunk and into the pulmonary artery and into the lung for oxygenation. Yes, and the lungs have already oxygenated it. As the lungs have already oxygenated the blood will come back into the left atrium and the left ventricle, passing mitral valve, which is actually the left-sided AV valve. So lungs will oxygenate the blood. Yes, lungs would have oxygenated blood and sending it to the left atrium, and from the left atrium to the left ventricle, passing this mitral valve. And what will happen to this blood from the left ventricle then? From the left ventricle, it will be passing out, and then it is passing out through what is called as the ascending aorta. So you're telling that left ventricle will push the blood out into some ascending aorta towards the systemic circulation. Yes, towards the systemic circulation. That is the point. Now, if you say so, fine, that is good. This is normal. Yes, what is abnormal? See here. Persisting truncus arteriosus. And what is that? Actually, there is a persisting truncus arteriosus and you don't have ascending aorta or pulmonary trunk. There is a common vessel. But if there is a common vessel and there is a persisting truncus arteriosus, I think there will be mixing of blood. Yes, there is mixing of blood. The blood which is supposed to go through the lung for oxygenation has got mixed up and going to the systemic circulation, so resulting in cyanosis, congenital cyanotic heart disease. So this baby will not have the ascending aorta or pulmonary trunk. No, actually they have merged into one, or they were not separated into two. That is the point. AP septum. You mean to say AP septum is absent here? Yes, because the AP septum is absent. There are no two vessels. There is the original vessel which is persisting truncus arteriosus. And what about the anomaly number 2? Anomaly number 2 is that transposition of great vessel. And why do we have transposition of great vessels? Because AP septum is not spiral. Okay, AP septum is not spiral. Yes. So vessels are not spiral? No. So they are straight? Yes. And they open into opposite ventricle? Yes. Which ventricle they are opening? See here, right ventricle is pushing the deoxygenated blood into the ascending aorta, which is not good. And the left ventricle is pushing the blood into the pulmonary trunk and lung. This is not good. Why this is not good? Because these babies do not survive. Why they don't survive? Because you understand, the blood of the body is coming from the superior vena cava, inferior vena cava into the right atrium, and from the right ventricle, from the right atrium, it will go to the right ventricle. So blood is coming from the upper body, superior vena cava, lower body, inferior vena cava into right atrium, and right atrium will push it to the right ventricle. Yes, and this right atrium pushing it to the right ventricle will push it into normally pulmonary trunk. This time it is ascending aorta. You mean to say you're sending blood into the systemic circulation without oxygenation? Yes. See, the blood comes from the body and you are sending it back to the body without oxygenation. Survival is not possible. So what should I have? You should have some communication. Like what communication? You should have PDA. PDA is an essential requirement for the survival of TGV. You mean to say patent ductus arteriosus? Yes, there should be a patent ductus arteriosus which will keep sending blood into lung for oxygenation. So some blood will keep going to the lung for oxygenation, and it is an essential requirement for the survival of the TGB. And these patients also develop ASD, VSD. Why they will develop ASD, VSD? Because you want to send more and more blood towards the lungs. That's why. So you want to send more and more blood towards the lungs by ASD, VSD? Yes. For more and more oxygenation, and baby might survive. Okay, so what about the third anomaly? Third anomaly, if you want to discuss, then it is tetralogy of Fallot. Why it happened? There was some anterior migration of the AP septum. What will happen if anterior migration of AP septum? You see here, if the AP septum is migrating anteriorly, then this anterior vessel will become narrow. What is that called? That is called as pulmonic stenosis. So anterior vessel became narrow, the pulmonic stenosis. Then what the posterior vessel would have become? Large. So you are telling that aorta would have become large because pulmonary trunk has become small. Yeah, that is the point. So this aorta, not only it become large, but it is also, see, anterior vessel become narrow, which is pulmonic stenosis. At that cost, the posterior vessel became large, which is in fact called as overriding aorta. Why would you say overriding aorta? It is called overriding aorta because it is overriding the interventricular septum. But if it is overriding the interventricular septum, then it is opening into both the ventricles. Yeah, it is opening into both ventricles, and this is called as the VSD, ventricular septal defect. So there is a ventricular septal defect in the membranous part of the VSD. Yeah, this is the muscular part, that would be the membranous part. So this is muscular part and that is membranous part. Membranous part has some VSD now. Yes. And what will happen now? See, the blood is mixing between right and left ventricle. Yeah. So you can understand that the right ventricle will undergo hypertrophy. It is not trained to accept this high pressure of the left ventricle. Normally, it was supposed to push the blood into lung, but now it is pushing blood into other places also. Like where? See, I will find that there will be right ventricular hypertrophy because it is sending blood at two places, which is making it hypertrophied. What is two places? Number one, right ventricle was trying to send the blood into a narrow vessel, so it has to work hard, and it is undergoing hypertrophy. So what about the other reason? Actually, right ventricle, if it could not send blood into the pulmonary trunk, then it will send the blood into ascending aorta. But if you send the blood into ascending aorta, it is at high pressure and you are exposed to high pressure. So again, hypertrophy. So this hypertrophy is because of two things, like pushing blood into some obstructor zone, yes, and high pressure zone. Yes, that is the reason for right ventricular hypertrophy. Actually, it is 3:1. What is 3:1? The right ventricle is 3 times thicker than the left ventricle. So you're telling that in tetralogy of Fallot, there is so much of hypertrophy that left ventricle has become 3 times thicker than this right ventricle has become 3 times thicker than the left ventricle? Yes, that is the point here. Right ventricle has become 3 times thicker than the left ventricle. That's the point. Right. So this is the tetralogy of Fallot. Yes, that is the tetralogy of Fallot. And what is this? That is additional ASD. Now what do you call it as? ASD means atrial septal defect. Yes. If I have additional ASD, that is atrial septal defect, then I'll call it as pentology of Fallot. Yes, that is what we call pentology of Fallot when you have additional atrial septal defect. Tetralogy plus ASD is called pentology of Fallot. Now we are having a question. It is asking us transposition of great vessel. What do you think is the answer? If you ask me transposition, then I'll tell you that the two big vessels are opening into opposite ventricles. Yes, tell me the answer. I think the answer is choice number C. Yes, AP septum is not spiral. Can you tell me one thing? What is the answer to this one? You mean to say NC displacement of AP septum? Yes. Tetralogy of Fallot? Correct. Can you tell me what is this one? Failure of conotruncal ridge, which is truncobulbar ridge, to fuse and descend towards the ventricle. Oh, this you told. It will descend towards bulbous cord, descend towards the ventricle. Yes, what if it does not do that? If it does not do that, I think there will be persisting truncus arteriosus. Yes, it is persisting truncus arteriosus. This will result in persisting truncus arteriosus because the truncus arteriosus is not divided properly, because there is a failure of conotruncal ridge to fuse and form the AP septum. No AP septum, persisting truncus arteriosus. And what about choice number D? Choice number D is something normal. Something normal means you have learned that neural crest cell would have come to the truncus arteriosus and form some truncobulbar ridge to descend down towards the ventricle and form a spiral septum, which is called AP septum. So it is okay. Yes, choice number D is okay, no problem there. But choice number C is a problem. So if we say choice number C is the problem, we'll keep that answer. Yes, you have to keep that answer. Transposition great vessel. Yes, transposition great vessel.